want to call the meeting of the Social Services Board to order. I'm Jan Elliott, Director, and I'm filling in for Mary Perkins Williams, our Vice Chairman, who's been unavoidably detained. First, let's have a moment of silent prayer or silent meditation. I have been informed that we have no one wishing to make public comments this afternoon, so we will proceed with our business. The first thing is the adoption or revision of today's agenda. Does anybody have anything?
Madam Chairman, I move that we approve the agenda as presented.
Okay.
And I second.
Hold a second. We got one. I've got one little thing here, so let me get that done, and then we'll go there.
Okay.
The appointment of representative to the Community Child Protection Team needs to be moved to an action item, okay? So we will do that if that is okay with everybody.
Yeah.
Okay?
Now, after the correction, I move the adoption of the agenda as presented, Madam Chairman.
Okay. Thank you so much. And I had a second, did I hear?
I second it.
Okay. All those in favor?
Aye.
Okay. I'm going to turn it over to our vice chair who has arrived.
Thank you.
We're at the minutes.
Minutes. Are there any corrections?
I move to approve, second.
It's been moved for approval by Melody, second by Mr. James. All in favor, let me know by saying aye.
Aye.
Thank you. Minute stands approved. Section of the, now we have the selection of a vice chair and a chairman.
The chairman. Okay, now.
Are we going to do both sets of minutes under that one action, or is that?
Should we? Yeah, we should. I think so.
we can do that
How
for
about
both
the
sets?
second action?
Move to approve.
This is
The
for
call
the
meeting.
special call meeting. Melanie moved that we approve the special call meeting.
And
Is
I
there a
second.
second? Second by Becky. All in favor, let it be known by saying aye.
Aye.
The minute stands approved as you received them. Now we will have the selection of a vice chair and a chairman.
Which first?
Let's go with the chair.
I nominate Melanie Bryan
Melanie?
for Chairman of the Board of Social Services, Pitt County.
I move that the nomination close and she be accepted by our commission, please.
All right. Melanie has been motioned for chairman of the Board of Social Services, and it has been moved for second. All in favor, let me know by saying aye.
Aye.
Oppose? All right, now we have vice chair.
Madam Chairman, I would like to nominate Becky Starkey for vice
Becky
chair.
Starkey is vice chair, been nominated.
And I second that motion.
This was second by Melanie. All in favor, let it be known by saying aye.
Aye.
Then Becky is now the vice chair. Let's switch seats.
Okay, and
Welcome back. We have nominated new officers, and we are now rearranged with the new chair and vice chair in place, and we will move to reports to the board. First item is the budget report, PJ Quinn.
Tell you is that in our budget that was approved for this fiscal year, we had a half-time position for a lawyer in the Department of Social Services, the money was approved, but when it went to the commissioners, the increase in number of personnel was not there. So that will be presented to the commissioners on the next meeting, at the next meeting.
So inside of the funding that was approved, is the funding for the position, just the head count itself was not?
Right,
And so
that's
that'll go to
correct.
the county commissioners for
Right.
sort of a retro,
To increase the head count, right.
okay. And you'll let us know when that happens so that,
Yeah, I think it's gonna go on the 21st, in that event.
okay. NC Fast update, Brian Averett.
Thank you. In your packet on page 8 is our monthly report on how we're doing with processing applications and reviews in food and nutrition services and the Medicaid program. What I would like to highlight about this report is that as of the end of June, the applications and reviews that still need to be processed from through the period through June 30th is 5,884. We've been tracking this number on a monthly basis to show the capacity of the current staff and how we're doing with processing in these areas. I'd like to point out that we do have a contract with Vanguard Staffing to process family and children's Medicaid reviews and adult Medicaid reviews. And to help us work on this number, we will be sending about 1,460 reviews to them later this week for them to begin processing. Outsourcing this with their people who are qualified to process reviews will help us get the review, work on getting the review backlog caught up while we focus on the applications project. And the information on the applications project in Medicaid is on page 9. This report shows where we were when we started on June 21st with the focus on processing the backlog Medicaid applications. It shows the total number pending. The total number pending, 3,453. Of those, 2,277 were past due. The number of applications pending on July 9th, 2,667, 1,466 of those are past due. The report further shows that we processed in that period of time from June 21st to July 9th, 1,124 applications. Of those, 811 were past due. So as of July 9th, the number pending is 2,667. That's total Medicaid applications. And of that number, 1,466 are past due. So it shows that we processed 1,124 applications during that period of time. And we've done a calculation over 11 days. We didn't count the holiday. We have processed an average of 102 applications per day. Our target of processing is 100 Medicaid applications per day. The target is set in an effort to meet the August 31st deadline, which is set by the state. And what we've done, we've included an average, we're averaging receiving 28 Medicaid applications a day. So we plug that figure in along with what we currently have pending, and at a rate of 100 applications processed per day, it should put us close to the target of getting this project finished. This is a conservative estimate because we have factored in all the applications that are going to be taken up until August 31st. There is a 45-day processing time frame, which means that those taken the first part of August on through August will be due in September and in October. But we wanted to work with a conservative estimate so that it's better to go ahead and include everything, because we're looking at processing, now we're processing a lot of the federally facilitated marketplace applications, and we're removing duplicates from the report. The federally facilitated marketplace applications sometimes end up being denials if an individual is approved for Medicaid. So we're seeing a lot of activity. We're focusing on those areas to get those applications off the report, and at the same time working with the full Medicaid applications that have to be processed. So we recognize that all of them are not going to be as easy to process as some of the ones we're working on the front end. But we are taking that into consideration, and we are monitoring that on a daily basis, so we can make adjustments if we have to. There's one other thing I would like to mention related to the Income Maintenance Division, and that has to do with our Crisis Intervention Program funds. We received on July 7th $107,730 in crisis intervention funds. This is for the cooling assistance that's being provided during periods of extreme heat. That was received July 7th. As of today, we are down to $49,597. When I was over this morning, we had about 30 people initially applying this morning, and more were coming in to apply as I left to come over here. So at the rate we're going, this money is not going to be here for an extended period of time. We're advising clients when they apply that the application process and approval is subject to the availability of funds, and we are processing the applications in the order that the applications are made. So we just want the public to be aware. We are taking the applications, but we don't know when we're going to receive our next allotment. This is not all of the money we're set to receive for this fiscal year, but I'm being told the holdup is because the General Assembly is still in negotiations about the state budget. So that's why we've not received anywhere close to the full allotment we're expected to receive for the fiscal year.
Thank you. For those applications that you received that would have been eligible, but you're out of money, are you holding those in a priority order so that should another allotment come through, they don't have to reapply, they're already in the process?
We cannot hold them because the crisis has to be alleviated within 18 hours or 48 hours. It has to be alleviated within 18 hours if utilities are disconnected. If the utilities are not disconnected but subject to be disconnected, we have to alleviate it within 48 hours. So unless we got the funding came in and we had some there that we could work on, in that case, if we did, we would approve them, but otherwise we cannot.
I have several questions. All right, the deadline is August the 31st. Are we going to be able to meet that deadline?
Based on this calculation, if things remain constant, we feel confident about meeting the deadline. There's some other variables I just spoke about, like it depends on if the number of applications we're still receiving remains constant. If we receive an increase in applications, then that's based on the figures we have right now. And the deadline is to have all those that are past due completed by that date. So we feel good about it at this point in time, but we're going to have to monitor it and keep a close watch on it, and we're looking at the numbers on a daily basis.
Right, well, this is one of the problems that we've had in the past, not being able to meet the deadlines that has been set before us.
Right.
All right, the next thing I'm very much concerned is those cases that you're farming out, so to speak. Yeah. Who's paying that?
We have a contract with.
I know you have a
Stafford and the
contract,
county.
but where is the money, where is that
Okay.
money coming from?
Ms. Quinn, can you speak to that?
It's coming out of lapsed salary. We're paying for it, Department of Social Services.
I guess what I'm
We can
getting at
we get
is.
federal match.
Yeah, we get
We would
federal
get
match.
federal
Right,
match for
but
that.
that takes money away from people that you employ, does it not?
No, sir. What it amounts to is when there's vacancies and that type of thing,
Yeah,
the lapsed salary accrues, and that's what we would be using.
but wouldn't you use that money to hire additional people for the department?
Well, we will hire when we fill the vacancy, but if the vacancy is open for 30 days, that salary that you would be paying for somebody for 30 days becomes available to go for this as lap salary. So it's not keeping us from hiring anybody.
And the other response to that is that because these folks are trained and can be up to speed
Right.
fast, even if I went out and hired somebody today, they wouldn't be able to do the job for a period of time.
And this comes to the most important thing for me. All right, we are training our personnel to be crossover workers, from Medicaid to food stamps. Am I not correct?
Yes, sir.
All right, how many of these people now do you have that have been trained to take and to do both of these positions as we go forward?
They are doing the universal concept in the intake process. So when a person comes in and applies for whatever program, whether it's food and nutrition services or Medicaid, they see one caseworker for that application.
All right.
That application stays with the person that takes the application, and they process the Medicaid and the food and nutrition services piece. We are using some people from review because of the backlog project that aren't in the intake unit. We brought some of them in to assist with processing these that are in the backlog to also assist the intake unit with that. So we've got people in the intake and processing unit processing, and then we've got some in the review unit that normally do reviews that also have training that they can help process the application.
And he and I and the staff talked recently that they are working on getting the rest of the folks trained.
That's wonderful.
It's,
That's-
it just takes a little time.
I believe that's the key to it. If we're going to meet these guidelines that has been set forth for us to take and to meet, we've got to have our personnel trained to take and to do the job. Have we completely stopped on working with Pitt Community College pertaining to helping us in this?
No, we're still working
You're
with them
still
on that.
working. But
And,
if
yeah.
we're going to take and meet that deadline, we're going to have to
Right.
take and to get the most.
Correct.
And I know you got a big job, don't get me wrong.
Yeah, and one of the things we talked about with the new folks coming in is to go ahead and start them
Right.
in this concept. Now granted, they'll have to focus in one area a little bit to get started, but try and make them universal as they go.
I, as one board member, would like very much in the next meeting that you kind of give us a report as to the progress that is being made pertaining to these workers that's being able to do the crossover work, if you will, please. Because I
Universal.
believe that's the future. If we don't get that, we're going to stay in trouble.
That's correct, and I'd like to say thank you to the staff. You know, we had a February deadline for the Food and Nutrition Services,
Yes.
USDA, and then we had a March 31st deadline, and we met those deadlines. The staff pulled together for that project. They're doing the same for this. They're approaching it with the same effort that they did that. So we're really pleased with how everybody's working
Yeah.
together on
And
it.
we, the board, I'm sure all of us are in agreement with you, and we want to. We don't want the state owners like they were one time. You
Right,
know what I'm
right.
talking.
We do know.
And that's
And-
our job and responsibility to see that it doesn't happen.
And
Thank you.
I sat in on the most recent conference call with the state, and they're, I think, really pleased, it sounded to me like, with the progress Pitt County's making.
Good, Jay, we appreciate that.
Any other questions before we move to the next item? Technology report, Gwen Burns. And you would go ahead and do integrity while you're there.
Okay, the technology report you will find on page 10 in your board packet. And these are the projects that we have currently identified as projects that we are working on to implement a better way, more efficient way of doing things in the agency. We have a kiosk implementation, and as I explained at the last time I did the project updates, we have placed kiosks out in the area where clients can come in and they can do their application out in the reception area. One of the things that this project is all ready to go. They can come in, they can sit down, and they can key their applications. The only holdup right now on the project is that the staff that would be assisting with the kiosk implementation are now helping out with the Medicaid project. And so we've kind of delayed the kiosk project right now because we need those staff to be helping with those Medicaid applications. But we are ready to go with the kiosks when we have someone that can go out and monitor clients as they key in their application and help them with the process. So we are ready to go as soon as we have staff available to assist. NC Fast scanning, we have moved forward with the scanning process, and we now, the workers are capable of scanning in documents, and they can, they will eventually be able to scan their documents onto the NC Fast application, whether it's Medicaid, food stamps, or whatever. For instance, like if a client is asked to bring in pay stubs for their application, and they bring in those pay stubs, we can now scan those in and attach them to the actual application, so that when the worker pulls up the application to work on it, they will have the documents there to already go on and start working on the case. With Social Services Legal Department, we are now scanning in court orders and court reports. And once those reports are scanned in, they are sent directly to the attorneys and to whoever needs those reports without us having to hand deliver them or having to make copies of them. Like, for instance, 8 copies of the court report are needed in order to give the court reports to all the different attorneys, to the parents, or whoever needs a copy of the report. Now we can scan that document in and send it on to the attorneys where they can make copies and give to the parents or whatever. The DSS smartphones, all of the social workers now have smartphones that are assigned directly to them instead of sharing sharing cell phones. And they have the ability to link up with the internet and link up to other areas within the state government, like OLV, or pull up criminal background checks and those kinds of things without having to come back into the office. They can now do it from their cell phone. We are in the process of training on the use of the smartphones, and Verizon has agreed to come in and do what we are calling lunch and learns, where they will sit down with the social workers in groups and show them how to use their phone and to be more efficient with their phone. So that's where we are at this point with the smartphones. We have outpost workers that are out at Vidant Hospital, at the Bernstein Center, and these outpost workers do the work of social services on site at Vidant Hospital and the Bernstein Center. And we have been working on giving the outpost workers remote access so that they can access the same types of programs that are accessed here at DSS on the computers. They haven't been able to do that. They would have to come in, for instance, and do their timesheet. They would have to come to DSS to do their timesheets and things like that. So what we've been working on is for them to have remote access on their laptops where they can now do their work without having to come into DSS to do things like timesheets. This was tested out this morning, the connection for the remote access for the outpost workers. I don't know the results of what the testing was yet, but it was tested out this morning. And following, if the connection is okay, we are going to be training the outpost workers. They're already set up for training in how to use their laptops and how to access what they need to from their own work sites. We are also working on document management scanning for child support. So child support is looking at scanning their inactive cases and saving those images electronically and using Pitt County's secure document management system to store their documents also. And this is in the security and testing phase of this part of the project. And our last project that we're working on is the Adult Services ECAP scanning. We are now required, we've received updated software with our CAPS program. And this is our program that allows our clients who, it allow our clients to be maintained in their homes without being in a nursing home, providing them the care that they need to stay in their home. But with the updated software, we are now required to attach what are the FL2s, which are the documents that give DSS permission to provide certain services to these clients in the home. This new part of the project will attach the FL2s to our documentation and other documents that we need to send to the state or to process for the state. So what we've tried to do in our technology updates, along with keeping NC-FAST up to par and keeping us with what we need to do to move forward with NC-FAST, we've also started looking at other projects and other things that we can do within social services to make our jobs more efficient and easier.
I have a question. One of those outpost positions that you have, does that include the children's hospital?
We
You
have
said Vidant, but I was wondering.
outpost positions for Medicaid, taking of Medicaid applications. And we also have we do have a Child Protective Services worker that is assigned that when reports come in from Vidant Hospital, that they are assigned to investigate those reports and work with folks at Vidant. We do have someone assigned to do that also.
Are they located at the hospital, Gwen?
They are here in-house in the
We have
agency.
an APS worker that's co-located
Right.
at the hospital.
What was that?
We have an APS, Adult Protective
Services
Service worker
worker.
that's at the hospital,
But
I
she's,
was looking for children.
but not, we don't have a child.
We don't have a child person.
The income maintenance staff that are assigned to the hospital, or is anybody stationed actually in the children's side of?
They're not stationed in the children's hospital, but they're available to go anywhere in the hospital and take an application that one is needed to be made. So they can, they
What's
are,
the time period for those?
They have the same
Work
deadlines as for
For
any other.
scheduling.
You mean Monday to Friday,
Yeah,
8 to 5
yeah.
kind of thing?
Time of the
Work
day,
schedule.
because, you know, sometimes at night you have the problems.
well, we don't have anybody there in the evenings, but if somebody wants to make an appointment with any of those workers, they can make an appointment. They schedule appointments, and there's also one worker, like, if somebody's gonna be discharged today, she's available, they can call her and she can go ahead and do the application before the individual leaves the hospital. She does those types so that it can be done before the person even goes home. So she's sort of flexible in being available whenever she's called.
So everybody would be, they would make the hospital is gonna make every effort to make sure that we're made aware of anybody who needs to make an application, so that we can get that person where they need to be.
In the child protection.
Well, you know, in any of the units of the hospital, they're not gonna let somebody leave generally who hasn't had the opportunity to make an application. I mean, they're not gonna bar the door by any means, but they're gonna try to make sure that they get that Medicaid application taken, because they wanna get paid.
Right.
And we have a good working relationship with the social workers in the children's section, Ms. Perkins. We have a good working relationship with them where they call us when they need us or let us know what is needed so that we can take care of it.
All right, Brian, the one that's across the river, Bernstein Center. Greene County is involved in that particular center. How does Greene County play a part with Pitt County? Because that's a very busy place. All you have to do is go by days when they're open, and you'll see 100 cars there.
Right.
What part and how are they involved as far as social services is concerned with us?
Okay. We are mandated, because it's a federally qualified healthcare center. It's in Pitt County, so we have to have one worker there to be able to take Medicaid applications for people that come into the center. So Pitt County is responsible for providing the caseworker at the center in Pitt
All
County.
right, so you keep one worker there at that particular center all the time. Do you keep that worker there when it's not open, certain days this is not open?
Well, she does come and work inside the agency sometimes, so she's working the full schedule. There are times when she does have to come in and do things in the income maintenance building, but for the most part, she's there the whole time they're open and available to take applications.
Do we in the social service department encourage our people here to go there and use the pharmacy and other
Yes.
facilities?
Yes,
A lot of
we do.
people don't know that,
Yes, we do.
and I think it's very important that
I,
we.
I learned this past weekend, Eugene, that the Bernstein Center does not accept any more applications. They have to go to Snow Hill. The lady lived just beyond, you know where Country Mark is
Oh,
on
yeah.
Highway 13? And she was complaining because they would not receive her application, does not work. She's disabled, and her husband is military and disabled. She can't work, but they told her she had to go to Snow Hill to do an application. Now, if my information is not correct, it came from a potential client. So I was concerned about citizens of Pitt County not having their health addressed because of these kinds of things.
Well, I have gotten that information from them when I've called for clients before, that people can be seen at the Snow Hill site because they don't have the numbers of people they're dealing with at that site. Now, we would take a Medicaid application in Pitt County on an individual, but if they're not accepting new patients at Bernstein because they've got all they can manage there, they are telling people, if you want to be seen, if you go to Snow Hill, we can have somebody see you there. That's sort of what it sounds like it's being described to me.
Is there any way to address that problem for Pitt County residents?
Well, that would have to be addressed with the Greene County Healthcare Board. They deal with whether they have enough doctors at that site to see patients, and based on the numbers that they're seeing, that
And
would be.
Pitt
that
County
would be where that
doesn't
would
have
to be
any
addressed.
input or whatever into that. Our residents can't get that kind of medical services anyplace else.
And being new, I don't know, does Pitt County have representatives on that board?
I have no idea.
Because that would be the place to address it, I would think, as y'all were saying, was through that board.
Is that something we can find
We
out?
can certainly
into
ask
that.
I
that
would
question.
appreciate knowing, because when community comes up, and I don't know everything about social services, and I've never been a social worker, but I like to respond to the community when there are problems and concern. And so I must rely on you to find out for us, because we don't want anybody dying for lack of health service.
And I don't know, I know a lot of the medical practitioners do limit the numbers of patients they can take and that kind of thing. So I don't know if there are other resources in the community that could, if they just went to a different doctor, would there be somebody else that could serve
Well,
them?
this lady was
better?
having chest pains, and so
Yeah.
I ain't know who to tell her other than Vidant and Bernstein. So she went to both
We'll certainly look into that.
and was told to go to Snow Hill. If you're having chest pains, you want to have medical
to go to
attention
the
right away.
hospital.
They need to go, right, that's
She
right.
went to the hospital. She went, but
All right, are there any other questions on the
thank you so
technology?
much.
Oh, you're welcome.
Do you want to do your integrity report?
Okay. The overpayment report is on page 11. We are now going to do the overpayment report in open session. We had one agency error in the amount of $526. Are there any questions about that?
That the only one we got this time?
That's the only agency error. But on page 12, if you turn over to page 12, there's the overpayment investigation report, and we have 28 cases on this report in the amount of $14,404. Are there any questions about any of these?
Since this is the first time, you want to say, what these are.
Okay, these are inadvertent household errors. And these are errors as a result of disaster food stamp cases for Hurricane Irene. The state sent us 270 cases from Pitt County that they wanted us to look at in terms of whether the income had been reported appropriately. And we have been reviewing those cases for some time now. And these are the last of, not the last of them, but these are some of those cases from Hurricane Irene of that
Good.
270 cases we were reviewing.
Thank you for that explanation.
Okay.
I think that's wonderful. We need to check on these people to make sure that they are entitled to what they get.
Yes. And then there, right in the middle of your report, there is a dual participation. And that's a little different from the rest of them, but this was one where the client was receiving food and nutrition benefits, had received them twice. But if you can see, the client came in and they had the money deducted from their, they agreed to have it deducted from their EBT card. So they have already paid the $547. They've already paid it back. Are there any other questions about this report?
I have a question, and I used to teach elementary school, and I told my kids the only dumb questions are the ones you don't ask, so I'm just trying to get my feet wet. But I was wondering, what is in place to verify these applications before they're approved?
This report is a result of if someone came in and they applied for food and nutrition services, we would take that application, we would go through the process at that time of verifying their wages, verifying their work history, verifying all of those things at that time, okay? If something is found incorrect at a later date, that is where program integrity steps in. And we say at that time, you received food stamps in the amount of $547 for the month of May, but you were not entitled to them for whatever reason. We may find that your income was not reported correctly, that you didn't provide us the correct wages or whatever. And then we would go back and say, you were not entitled to those benefits. And we would ask you to enter into a plan where you would repay that money back to us. And that's basically what program integrity does.
During the disaster food stamp process, though, we abbreviate things a little bit, so, because the idea is to get food in people's hands as quickly as possible. So although we still go and check this, it sometimes is after the fact as opposed to, it's more of a declaration kind of a process. And so that's why there's so many errors that are identified, because when you really get back and start digging, you find that things happen, that people didn't understand the question, whatever,
Right.
you know.
So, but in a normal circumstance, you verify these figures before something
Yes.
is approved. So then you don't have to go back and, okay.
This is after the fact where it had been verified, the person has received the benefits, and then we find that there is an error. Something was not right,
Yeah.
and the person wasn't entitled to the benefits, and the benefits need to be repaid.
Right. I'm just glad to know that in a normal circumstance, before something is approved is when you need to say you need to correct your figures.
Yes.
Rather than after and then having to go back and correct and, you know, so, thank you. I don't know if this is time to say, but I want to take a moment also to thank Susan May for emailing the minutes today so I could have this ahead of time to see.
Now we have the appointment of a new representative to the County Child Protection Team. And do you want to talk about that?
Okay,
for us,
well,
Ms. Jan?
Sure. We've had a representative, Becky's been our representative, and for a variety of reasons, right now, she can no longer serve, needs to come off. The Community Child Protection Team is a very important team for us. All of our child protection issues, there's the opportunity to review some issues there, to discuss those issues, to look as a community, and I'm looking at Margaret so she can jump in, but to look as a community about systems and what kinds of things are happening and how we can impact that. So it's a very important job and something that we need to have representation on, and it's a wonderful way to learn about child protection plus to have some impact. So we're really sorry that you're not going to be able to continue to serve, but we do need somebody from the board to serve, and so I'll
Well,
turn it back over.
in view of the fact that I am stepping down out of time, I have talked with Coral and told her a little bit about what would be involved, and she sees it as a great chance to get an overview of what everything in our county is about pertaining to children. And so if it's time proper, could I nominate Coral Whitchard?
I want to know why you stepping down. I don't understand what's happening right here.
Well, what's happening right here is I have a ongoing problem with my lower back.
Oh.
And the meetings begin at 8 o'clock in the morning, and I find that a little challenging.
Okay.
I move
Well,
that
I
the
just,
nomination close, Madam Chairman.
I was getting an explanation.
You got it.
You got it. Well, if you
Okay,
want
so-
correct parliamentary procedure, when somebody is nominated, you don't start the discussion on that.
Okay, so Becky is going to step down, but she suggested that Coral Whitchard take her place on the committee. Mr. James, you seconded that?
Well,
Nomination?
nomination don't have to be second when you appoint somebody. I move that it close.
Okay, then,
Look at parliamentary
unless
procedure.
there are any other nominations, then as a board, are we all ready to vote that Coral be our representative on the Community Child Protection Team? All in favor?
Aye.
Aye.
All opposed? So ordered. You now have that role, Ms. Whitchard.
We'll put you on the mailing list.
I'd like to inform Ms. Whitchard that our next meeting is this Thursday, July the 17th, at 8 a.m. at the Health Department, and I can email you an invitation
That would be
to the
wonderful.
meeting.
Thank
How
you.
often does it meet?
We meet
When?
once a quarter, but recently we've been meeting a little bit more frequently because we've been trying to get the team up and running and established
Can you
really well.
provide a little more information about this, please?
Okay. The Community Child Protection Team is a team that looks at safety issues and child welfare issues from the community standpoint. What is needed in your community to provide safety for children, to provide for their safety, permanence, and well-being? How does the community see it? And we get input from the community about what it is you see as gaps in services in the community, and how would you like to, what are the things you would like to put in place so that those gaps are not there in order to provide services.
And what's the makeup of
That's
this?
what they, we're the representatives.
What's the makeup, where the
Okay.
representative come from, who recommends them, and all like this?
Okay. The representation comes from all the different agencies within the community. There is a representative from Social Services, the Health Department, from the Attorney General's Office, Sheriff's Department, Greenville PD, from all of the agencies within the community that work with children and have a stake in what happens to children in
And
our
this,
community.
this board is under the auspices of Social Services?
No, it actually,
I
it
see,
is
I'm
mandated-
just trying to learn. I was asking questions prior to the vote
It,
so that I could understand.
it is mandated that Social Services assures that this team is practicing within the community, but Yeah, the
Statutes.
statute, there's a statute that says that social services must ensure that this team is in place within the community and functioning in the community.
Ms. Elliott, could I get more information on this board in writing, please?
I'll certainly be
Thank
happy
you
to
very
get
I
that
much.
for
would
you.
just share with you too that we're
Thank
in
you
the
very much.
process right now with the board of looking at goals and objectives and the kinds of cases that we want to review, setting that out a strategic plan. So we had planned to make a presentation to the board in the next month or so. So
This board is not something that, or an organization that I was aware of and know about, and as a community person, I am just merely asking on this,
Okay.
as a member of
Very
the
good.
board, for more information so that I can share it, since it came up today with the community, if ever I get a question. Because it seems like I'm getting a lot of questions lately from the community about things that I don't have knowledge, and I like to be informed. Thank you.
Ms.
Very
Perkins,
good
you
reason.
may not have been on the board, but prior to Ms. Starkey coming on the board, I presented to the board around the community child protection team and its purpose within the community. And on that date, I asked that and the board nominated Ms. Starkey to serve at that time.
Well, there's a lot of times when you come new to a board,
Yes,
you are
ma'am.
not abreast of everything that happens.
And you're,
Right.
And you left out of the loop, you don't know, so you need to expect me to ask them. from
I
now
will
on.
ensure in the next board packet that you have information on the community child protection.
Thank you very
team.
much, because if you
You're
don't want me
welcome.
talking, you're gonna find it. And since I don't have the chair or vice chair anymore, I'll be very vocal.
Yes, ma'am.
and you know, you bring up a good point, that people do rotate on and off these boards, and we need to make sure that new people coming on have a list of the different types of teams that are out there, you know, some of those kinds of things, and then if they want to ask more, even if we don't do a.
It may be good to know where we have representatives in the community for the Board of Social Services,
May
as
I-
a board member.
May I suggest something also to our attorney? There's a little handbook on Robert's Rules of Order, way to conduct meetings, motions and so forth. I would appreciate if you would get, I think all boards ought to have one. They cost very little. See if you can buy it. They got it.
Am I out
got
of
one.
order today or something, Ms. Tex?
No,
Attorney?
I'm not that. I think we need to know.
Am I out of order? Thank you.
Next item on the agenda is the director's report. Ms. Elliott.
Okay, great. On page 13 of your packet, you will see the vacancy report at this time. If you can look down at the bottom, you can see that we currently have 24 vacant positions that we're in some stage of recruiting for. 5 of those are frozen. We are currently interviewing 1, advertising. It says advertising 2. What I will say, as you see, we have 10 IM caseworker 2 positions. That's the first 10 of our 28 that we were approved for, that we're currently recruiting for in a single lump. We're doing 10 at a time just because for just the whole process issues, it's easier to bring them in that way. So that is part of that recruiting there, or advertising. We have 11 that are in some form of the screening process. We're doing reference checks on 2. You can see that we have filled 3 positions, me being 1, since the last meeting. So we're making some progress. A lot of things are going on right now. And since I have never given this report before, I will see if y'all have any questions. I think you've been getting this report for a pretty good while, so
Yeah, we
Should be
have, but I
familiar
was
with-
looking at, that CPS is Child Protective Services.
Child Protective Services,
And-
APS, Adult Protective Services, thank you. IM means income maintenance for all of y'all who are still learning our lingo.
And now my question is, with the Child Protective Services, and you are screening, you are rigorously advertising for
Yes,
that.
ma'am. Yes, ma'am. We're,
And the qualifications. I was just repeating that so the public know we
Right,
need
right.
some Child Protective Services
right.
applications.
Right, and we, as you see, we have a number of these Child Protective Services positions in a variety of places, well, Child Protective Services, foster care, adoption placement, and some supervisory positions, and they're in varying stages of advertising, screening, et cetera.
Thank you. Because the public doesn't see this
I
report.
understand that. You keep me straight here, please, okay?
And my only question is, typically when you make the comment or Earl Merritt made the comment that there were frozen positions, the county manager would point out that no, they're not frozen because DSS is not subject to the same hiring 30-day period wait
Right.
that most departments. So I guess I just would ask that you double check how you use the word frozen, because frozen in other general county departments truly means there is no opportunity to advertise, and I think he treats your positions somewhat differently.
We have to justify to get one off of that list, and we also have to address the hours of vacation pay that they have. So having just come in the door, we're working on all of these now to see where we are with that. He and I have already had a brief conversation about what I need to do to do that. Next item is the telephone report. That would be page 14 in your packet. And as you can see, telephone calls continue to be, we continue to be very active. In the month of June, just going to the bottom line, we had 157,610 telephone calls, if I'm reading this correctly. And so it's not our highest month. We had 207,599 in January, but we are continuing to have a significant number of phone contacts here in the agency that somebody is dealing with each and every individual call. And I don't know what other questions you might have. The report is broken down by program area or administration or whatever, so it gives you some idea of those kinds of things. Anybody got any questions? Okay. The other thing I had, the hero certificate, I wanted you to know that the Red Cross did recognize this agency for being a hero. The staff did a wonderful thing. They raised, and I must confess, I left my piece of paper, but they raised $1,300, a little over $1,300 in a raffle, and that was presented to the American Red Cross. And so we will be presenting that information to the staff, the certificate that they got, but wanted the board to be aware that the Red Cross has recognized the staff for their generosity in supporting the Red Cross.
I was wondering, is that the one that you get locked up?
No, they did this with a raffle for, Mr. Perry bought a TV set, and he raffled it off, and staff were very generous in trying to win that TV set. So they did a really good job with it, and I had this lovely package for you, and I walked off and left it.
The one for, just excuse me, to
yes.
answer your question about the lockup, I was the one that got locked up and sent to jail. We raised a little over $800 that day for that.
I think that needs to be noted.
And it was for
To
muscular.
be locked up
Yeah.
or something.
It was for muscular
It was a great
dystrophy.
day.
Depends on how you look at it,
Money.
how great a day it was, because this is kind of a little funny story. The state trooper came and got me. He told me I was gonna have to be handcuffed behind my back, and I said, no, sir, I cannot do that, because I don't think I could walk that way. But in the meantime, he took me off in his patrol car, to jail. Well, in the meantime, a Greenville policeman come over here to get me too, and the young lady at the front desk, when I finally came back and she saw that I hadn't really done anything, she thought I had really done something really bad and was really being arrested,
Two different law enforcement
It was kind of
looking for you.
kind of a big thing, because she thought I'd gone to jail for sure. But yeah, it's kind of an interesting thing when you get handcuffed and you've never
Yeah.
been that way, even though it's okay. But we raised over $800 for us, and I thought that was really great.
People wanted to
Okay.
get you out of jail, did they?
They did. Some of them did, some didn't.
knew.
I called.
She knew who to call.
I had my number of board members to call.
And on that note, she has announced that she will be retiring as of the end of this month, for those of you that have not heard that. We are very sad. I have offered the opportunity to renege on that request, but at this point, that is where she's planning to go. And she made it clear that she wanted to wait and make sure we had a new director on and that kind of thing before she did this. She's been wrestling with this for a pretty good while, so.
You said retire.
Yes, ma'am.
we're gonna call the police again.
Chain her to her desk.
That's right, that's right,
Chain
that's
her
right.
to the desk.
We can unaccept it, but I do understand that that is where she wants to be
Yeah,
right
she
now.
wants to go.
So, the next thing that I have in my report is, if you all remember during the interview, I thought about, I thought it would be a really good idea to have a board retreat. It's an opportunity to, one, share information about programs and services so that y'all are all kind of on the same page. But even better, it's an opportunity for you guys to help put together some guidance and some goals and objectives, because at some point in the not too far distant future, you're gonna be having to set up a work plan for me to be evaluated on and all that kind of thing. So we would like to do that, and I would need to talk to you a little bit about what your thoughts are on that, as far as, ideally, we could make it a couple of day event, or we could spread it out, or, however you want to do that. So I'm throwing it out today. I don't know if y'all want to actually take action today about that, or if you want to think about it and at the next meeting actually come to some decision about what you'd like to do and what you might want to see on the agenda for such an activity. So I open it up to you all.
I have one question. For a retreat, other than the board, who's there?
I would certainly want to invite key staff people to be part of that, and obviously the media would be invited, because it would be an open board meeting as such.
I think we need to do it at the next meeting. We need some planning ahead of time. I would like very much to see the work plans of other social service departments,
Okay?
so that we would have some information as to what other departments are doing, and have that in advance of the meeting, of course, before we do meet, so that we ourselves might be able to plan as to what we would like to see come about. That's my thoughts.
In that, I'm here and there and everywhere. Email is good when you're out of town, but I have to change my setup because I like have things in my hand to read them. I don't like reading with the catalogs running. So if you give me a call, Susan, let me know when whatever it is available for me, I'll come and pick it up. And that way, I got a system, and I guess I'm a little cranky as far as getting my system, changing my system doesn't work too well. So I need to come and pick up my stuff. And I'd be happy to pick up my board packet as well. I read it, but I want it in my hand.
Yeah, I'm a little slow
Because I
with
like
that
making
computer
my
stuff,
notes
too.
on the.
Yeah, I like to write and do, so.
Yeah, I do too. I guess it has to do with age, I guess, but I like to make my notes on my doohickey so I can ask it in the right place. And I didn't print it out, and so I'm off. So I like to, if you give me a little call, leave a message on my home phone, and I'll follow through. Thank you.
As far as the retreat is concerned, I think that I personally would like to think about it
Right.
until the next meeting. So if I can make a motion, Madam Chairman, to continue the question about the retreat until our next meeting.
I second that, and the fact that we will receive the information that Mr. James is talking about.
Motion has been made and duly seconded to move the discussion of a retreat to the next agenda, but also to have Mr. James's request for some sample.
Just give us information pertaining to that.
All in favor?
Possibilities.
All in favor?
Aye.
All opposed? So moved. Any other items for the staff or board?
I would like to say how proud I am to have our new director. Is that all right for me to say at this time? I've heard many good things, and you are a bundle of joy that we welcome, and so glad you're here.
Thank you. I'm enjoying it.
Good.
We appreciate it.
Don't resign tomorrow.
Okay, Mr. James.
I came back this week. I thought that was pretty good.
Do your thing.
Who, me?
Yeah.
I move we adjourn.
Second.
Second.
Is that his job?
Always.